What is post-ICU PTSD? PTSD is a severe anxiety disorder that results when a person experiences or witnesses trauma. In this case, it's a form of PTSD that occurs after a patient has had a stay in the ICU. A person can experience flashbacks and nightmares of their time in the ICU. Diagnosis of PTSD requires that signs and symptoms last for at least 30 days after the traumatic event and that they significantly impair an important area of functioning.
What are some of the adverse health outcomes associated with PTSD? There can be pathophysiological changes, cardiovascular complications such as myocardial infarction and embolic stroke, increased risk for morbidity and mortality, decreased quality of life, and psychological disorders. Some of the risk factors associated with post-ICU PTSD include treatment with medical ventilation, sedation, delusional memories, and agitation. To be more in-depth, there are personal factors and ICU factors involved. Some of the personal factors involved are pre-existing anxiety and depressive disorders, the female gender, being age 65 or younger, and socioeconomic factors such as whether the patient has insurance or not. Some of the ICU factors are the use of vasopressors and sedatives, treatment with medical ventilation, delusional memories of the ICU, and agitation.
What can nurses do for post-ICU PTSD? First, we can assess the patient for risk factors. We can make the ICU environment less stressful by using earplugs, eye masks, and reducing the level of noise and light. We can advocate for lighter target levels of sedation, promote early mobilization. We can provide appropriate and adequate pain control to promote the patient's participation in early mobilization. We can use bedside manner and therapeutic communication. We want to communicate with all the personnel involved in that patient's care. We can advocate for a mental health consultation before discharge from the ICU, especially if the patient is at risk for post-ICU PTSD. We can also provide a follow-up after discharge. Ideally, we'd like to do this a few months after. If you want additional information, please visit myicucare.org.